Your position.
My name is Dr. Paul Saba, and I'm a family physician.
Thank you so much. So I guess I want to first ask, what are your initial thoughts on Quebec's measure to open two private clinics in Montreal in order to reduce long wait times in emergency rooms?
Yeah, I think we have enough family physicians, we have enough public clinics to do the same. And in fact, we need to even do more than what we're doing now. The solution isn't going to private because all we're doing is we're encouraging and promoting the private. We have a certain number of doctors. We don't want doctors leaving the public to go to the private. It's not going to increase the number of doctors. We have to increase the availability to physicians who are working in the public system. That can be through a series of incentives for people taking on more patients beyond the incentives they're giving now. This can also be including doctors who are wanting to reduce hours doing telemedicine and giving them incentives to do more telemedicine on off hours after 6 o'clock, for example, at the end of their day. There are many ways we can fix it. These are short-term solutions. Long-term solutions includes increasing the number of registrants to medical schools. I've written extensively on this. If you look at the number of graduates, we have about 1,000 people inscribed in medical schools right now in Quebec in each year. Um, we need to increase that cohort to about 1,400. If we do that within around 6 to 7 years, we'll have enough physicians, family physicians, of all these additional places, which is about 400 per year in all the medical schools, goes to family medicine residencies. The other longer term solutions will, of course, we have to look at the federal government giving more money. The federal government right now is contributing about 22 cents to the dollar for healthcare, and they need to go to 35 cents, if not more, as the provinces have requested. And the only guarantees the federal government really needs is that the money is being spent in healthcare. They don't have to know exactly where, but that it is going to healthcare. These are just some of the solutions, and we need to get people from the ground, doctors working in the community, asking them what can be done to increase access. Lots of people have ideas. I know, for example, uh, for example, even reviewing laboratory work for my patients takes time. It used to be on one page, now it's on 12 to 15 pages. We can change our computerized systems to put it all on one page. Um, there are also alert systems that can be put into place for doctors when things are abnormal, instead of them just to pile through papers where things are normal or abnormal. We can improve computerized systems to make work easier and faster for physicians. There can be a lot more home testing for patients. We did that with COVID testing. For example, we could even look at, for example, um, patients who need, for example, to check for screening for, let's say, strep throats, which is being done where they have to go to the pharmacist. There can be tests that are made more easily available at the pharmacies, just like we do COVID testing, so people could test themselves at home. Um, these are like quick, rapid tests that are available in a doctor's office. People don't need to have an appointment to go see the doctor. They can say, "I checked myself for strep throat. I'm negative, doctor. What do you want me to do?" Everything to simplify care, both for the patients and also make work easier for physicians to reach their patients.
I noticed that another issue is that a lot of healthcare workers are leaving the public system and moving to the private system. Would you say another way to address this issue in the long term is for the Quebec government to increase salaries for public healthcare workers?
Yeah, I think that there are. You need to find out. I don't believe that all doctors go into the private just for finances. that is a consideration. There's no question. Someone came up to me the other day and said they didn't have a pediatrician for their child who had you know, cold symptoms, and they went to a private and they paid $300. So I mean, it's often out of reach for the regular person. If you have four children, imagine paying $1,200 for a sore throat or earaches. Lots of people don't have that money, and we can incentivize. There's always ways to incentivize. There could be tax credits, for example, if physicians take on extra patients. There can be tax incentives. You know, people look at, you know, it's not only just giving them more money. There can be additional money granted in and above their usual patient care. For example, for the physicians who are in group practices, GMFs, there are already incentives. But people like myself who are considered solo practitioners, and we represent over 50% of the physicians practicing, and for various reasons, we've either the groups are already filled. There's no place, no capacity for them to join another group, or they just like the autonomy that they have working as a solo practitioner. We are not allowed. Um, we're not part of that access for people who need a rapid access to patients. We're not that plugged in or so that could be another thing, is to bring in the almost 50% or more of physicians practicing alone, allowing them access to help the healthcare system. So these are simple solutions that can be done.
Thank you. And when you mentioned earlier about seeking input from doctors, do you feel that the Quebec government is not already doing this when they make decisions to, I guess, alleviate the system or just major changes to the healthcare network?
And no, they aren't doing that. I mean, we sometimes see polls out there, but really, allowing ideas to be shared, as I'm doing with you right now. You've reached out to me, and I'm providing you from a physician working out on the ground. They have this committee, crise d'urgence, comité de crise d'urgence, which is committee. And if you look at this committee that's working with the government, these are people who are administrators. Not that they don't have any ideas; they know how to look at the bigger picture. But we need people on the ground sharing ideas, just like I'm doing with you, um, providing input. Telling what the problems are. I've just given just a very small portrait of what the problems are and how to fix it. They need to reach out to the doctors. Doctors can may be able to write in, speak in to solutions, and these should be made available to the bigger public. Shouldn't be kept secret. We need transparency. Um, what we're saying will be transparent. It's not going to be kept in a small committee room. It'll be broadcast. As I have done in the articles, I've written articles in the Devoir, I've written in the Suburban on how to improve the healthcare system, including community hospitals, family physician shortage, the ER crisis. Uh, but not everybody has time or has the giftedness to. I love writing. As you know, I've written a book, Made to Live, but I like to write. But not everybody has that experience or capacity, and it's not always easy to get published. So we need something where the public can, and even the public can participate. It'd be great to have a website where everybody can see how can we improve the healthcare system. Um, not denouncing, any practitioners because people are frustrated with the waits. We don't want to encourage more doctors to leave the healthcare system, but positive solutions. Their problems that they encountered and solutions that can be put into place.
Thank you so much. And I wanted to ask, when I was reading one of the articles you sent me from the Suburban, You had mentioned that
Yes.
one solution recently proposed by the government has limited benefit. It suggested that a patient who lacks a family doctor might have telephone access to a team of healthcare providers. Unfortunately, this is only a stopgap measure and will not replace the invaluable services of a family physician. Would you be willing to elaborate a little bit on this?
Yes, yeah, I think any stopgap measures are useful, and I don't want to stop those, but they can't be long-term solutions. Um, what we need, everyone having a family physician allows a patient to not only deal with the acute problem, but also longer-term problems that they encounter. Chest pains, abdominal pains, screening tests. If they're tired, you find out that they have a low thyroid, and that can be treated before it becomes more serious. Uh, People who have maybe some blood in their stool, and that you find out that they may be a benign condition, or it could even be cancer. We need to solve those problems, and along we don't want them to be to the point where they become chronic, or even worse, life threatening. So I think that those are very important. People suffering from anxiety and depression, uh, you know, they need access to a person face to face. We need obviously a lot. We were suffering a lot from anxiety and depression. This day, I'm seeing that more and more in the office because of isolation, because of loss of jobs, for many reasons, for family conflictual situations or isolation. Um, and sometimes the family doctor is the first person, a listening ear, somebody who can get them access into the um, availabilities of social workers or psychologists. And where there is a lack, we need to also increase. I know the government has said they've increased the number of psychologists um, available, and helplines. Those are useful. So helplines are useful, but we also need face-to-face contact solutions. And family doctors is the gateway for most people. Pharmacists have been very useful during this COVID crisis. When people can't reach, they go to the pharmacist and they ask, and the pharmacists, I've had pharmacists who have reached out to me. I have a patient, doesn't have a doctor. Would you be willing to help me with this? And we do. We work together as a team. I have nurses who will call, um, when they're taking care of my patients, when they're at home. So we do need to work as a team. So I don't want to diminish that, but we still need to strengthen the cohort of family doctors for the public.
Thank you so much. Lastly, I just wanted to ask, here and as well in your articles, you've mentioned preventative measures, kind of addressing things with the patient before the issue, increases. Do you think the way our healthcare system is operating right now, are we not able to really perform healthcare in a preventative way, given so many people are waiting for a family doctor?
Yeah, I think that prevention. I mean, it could be as simple as going for a walk. Sometimes people lack that motivation. This morning I did a very short walk. I still managed to do it, but I had to be here on time at my office. So we don't always get we don't always meet our ideal. We set standards, we set goals, but it can be something as simple as walk. Obviously, healthy diet, but people are finding it very hard in the grocery store today to buy fresh fruits and vegetables because of the cost. The government can, to a certain point, help. Families, for example, who are in welfare, providing them, not just giving them I mean, many times they don't have enough money to pay their rent, but there can be incentives if they, I think fresh fruits and vegetables, especially locally grown, that could be supported. That can be, but government they can give coupons to give people, families, especially families where there's several people or individuals, because lots of people live in are sit with, I call them single families. They're living alone, but provides fresh fruits and vegetables, coupons. There can be, um, you know, um, especially local grown economy. That's very important. Um, you know, do you need to have a membership to a health club? That could be down the road, but that's very hard for people for access. Um, we need to provide them with, I think, for people who can't afford it to get out. It could be bus passes to go to activities. You can give them, say, you can go to the museum for free just to give a change of venue, or some other activities. There are lots of activities in Montreal, but a lot of people can't afford them. I'm not necessarily saying go to a hockey game, which can be very expensive, but just activities, a bus pass so people can get out and have access, with public transportation. That also helps our environment, but it also helps people's psychological environment. And these, again, all of these ideas, I live in a very different financial situation but I'm aware of what people's limitations, because I do live in an area which is financially challenged here in Lachine, and my office is in the area where most people are very disadvantaged, close to the Lachine Hospital. Um, this is something that we need to do. And I'm even talking. I always, I've been very much of an activist for our community hospitals. We have to support community hospitals. When people say we don't need community hospitals, we only need big centers. We need big centers, for specialized care, but we also need community hospitals, because often this is a place, the last place, last refuge for people who can't reach a family doctor, and they need care.
Thank you so much for your time. Is there anything I didn't ask you want to share or that I should consider when putting this article together?
Yeah, yeah. I just would I encourage people not to give up. This is we've been through crises in the past. This is not the worst crisis. We're not going through a war here. I mean, there's conflicts around the world. We're blessed not to have that. Reach out to your friends, reach out to your family. Don't give up if somebody doesn't answer you. If your doctor doesn't answer because he's overwhelmed or he's retired, it's not a rejection. There are resources. The government has a line. Sometimes you can't get through, and people do want to help. There are caring people. Just because you may be in a difficult situation, things will change. Things will get better. Be hopeful.